Hi, my name is Statusepilepticus. I'm a neurologist, and I'll be talking about seizures and epilepsy today. So by the end of this video, we really want to convey to you what seizures are, what to watch out for, and what to do in case you see someone having a seizure. So living with epilepsy is like living with a vicious stalker who's following you around. You never know when they're going to strike. You could be at work, you could be at home, you could be in the swimming pool, you could be up on a ladder, and there's always this fear that the stalker will attack you and in some cases might even kill you. A lot of people have misconceptions about what a seizure is. A seizure is an electrical discharge coming out of the brain. It can come from different parts of the brain and it can manifest in very different ways. And epilepsy is a recurrent, unprovoked seizure. Now, what does that mean? Seizures can happen to anybody. I could have a seizure, so I don't have a seizure disorder or epilepsy, but if my sugar drops to 30 or my sodium, for whatever reason, drops to 115, my brain cells will get irritated and they will give out an electrical discharge and I will have a seizure. The treatment then would not be seizure medications. The treatment would be to not let my sugar drop down to 30 or my sodium, shouldn't be allowed to get down to 115. Some people have a tendency to have seizures for no obvious reason or without any triggering factors. And in that situation, it's called epilepsy. Epilepsy can either be genetic, where the nerves of the brain just have a tendency to fire when they're not supposed to fire, or it could be related to brain injury, brain infection, a previous stroke that left scarring in the brain, and those kinds of things can trigger these electrical discharges as well. As far as seizures go, you can have simple partial seizures where you don't lose consciousness and you might have twitching, or you might have a deja vu feeling, or you might smell something. You could lose consciousness and have mouth movements, or what we call automatisms. You could be just kind of rambling, walking around, but not really fall on the floor and convulse. And then you can have generalized tonic-clonic seizures. Now this is an oversimplification and we can talk about this in much more detail, but those are the basics of the different seizure types that you see depending on which part of the brain it's coming from. You're walking down the street, someone's having a generalized tonic-clonic seizure. What do? Well, for one thing, you want to turn them onto their side because you don't want them to choke on their tongue or on their saliva. Second, if the seizure is, you want to make sure that there's nothing around them that they could hurt themselves with. Maybe lay them down on the floor. Definitely call 911 because sometimes a seizure can continue and turn into what we call status epilepticus. During status epilepticus, people don't breathe and they can develop anoxic injury to their brain, and sometimes it can be a life-threatening emergency. And so these are situations that need to be evaluated right away. Treatment-wise, in addition to medications, which now we have more than 20 different types of seizure medications, and sometimes you want to customize it to the patient's seizure type and what other comorbidities they have. There's surgical treatments. There's vagal nerve stimulators that can be tied around their vagal nerve, and that helps control seizures. They can have epilepsy surgery in some kinds of epilepsy syndromes with success rates greater than 80%. Okay, well there you have it. That's Seizure 101. Please call us or reach out to us if you want more information on this topic or any of the other topics we've discussed. Again, my name is Sayed Assad. I'm a neurologist, and thank you for watching.